Good everyone. Good afternoon. Why don't we get started? I know it's nice to see people, and I'll encourage you to stay afterwards to socialize at the event. And at the same time, I want to take advantage of the event. So, good afternoon, welcome. I think I know most people in the room. My name is Tom Stelfox, and a scientific director of the O'Brien Institute. I'm delighted to welcome you to today's panel discussion. It's a joint Department of Communal Sciences and O'Brien Institute seminar, and our panel today is themed and is going to talk to us a little bit about beyond publication, thinking about how we can have our research not only translated to academic outputs, but what are some ways, we've got a diversity of expertise and experience here, what are some ways that that work can be translated into societal impact? I want to acknowledge that today's seminar is happening on the traditional territories of the people of Treaty 7 region in southern Alberta. This includes the Blackfoot Confederacy, comprised of the Siksika, the Piikani and the Kainai. We also have the Tsuut'ina and the Stoney Dakota, including the Chiniki, Bearspaw, and Goodstoney First Nations. The city of Calgary is also home to the Métis Nation of Alberta. So I think today's seminar is actually super important. And the reason I think it's super important is that when I think about the start of my career, my interpretation of an academic researcher was that as long as I publish, I can do whatever the hell I want. And I think things have changed somewhat over the past couple of decades. I think there's an expectation of society. I think we see it from the tri-council agencies, pretty clear signal that they want to see it. We're hearing it from the public, and we're hearing it from government. I think we're hearing it from ourselves as well. Most of us, as much as we want to have academic outputs and see our name in papers, that we also really do want to feel that we're actually contributing to the broader well-being of society. And so what the good news is, we've got an amazing panel that's got to guide this discussion. And our community really already operates in this space. But you largely operate at the intersection of society and university, and are particularly well positioned to do this, more so than maybe some other academics who might be looking to. And so I want to orient you to today's agenda. Very basic. We've got 4 panelists, so I'll introduce in a moment. They're each going to provide a few opening remarks. They're going to provide a few opening remarks, just highlighting some of the key things to think about when we think about societal impacts, spanning things like policy work, guidelines, industry collaboration, social media, and media. And then we're going to open it up for questions. I've got some questions to get us started. It takes a few minutes to get going. For those of you in the room, please put up your hand. For those of you on Zoom, please send a message via chat to Rico, and she'll get a hold of me. And the goal really is to be interactive, right? It's meant to be an interactive conversation. Those of you in the room also will have expertise that can hear this conversation. So for introduction, I'm going to introduce the 4 speakers in the order they're going to speak, and I'm going to hand it over to them. And so first, we've got Dr. Tonelli. He's Senior Associate Dean of Clinical Research here at the Kennedy School of Medicine, and he's an Associate Vice President of Health Research at the University of Calgary. Then we're going to jump to the other end. We've got Dr. Jennifer Zwicker, who is an Associate Professor in Kinesiology. She's a Canada Research Chair in Disability Policy for Children and Youth, and she's Director of Social Policy and Health at the School of Public Policy. And then to her right, we've got Dr. J.C. Boucher, who's an Associate Professor at the School of Public Policy and the Department of Political Science. And then in red here, we've got Kelly Johnston, who's a Senior Communications Specialist in the Kennedy School of Medicine. And just to give you a sense of Kelly's expertise, she's previously worked as a reporter, an anchor, an editor, and a director for media companies in Canada, such as CTV. So you can see we've got quite a range of expertise here to guide us. And so what I'm going to do is with that, I'm going to pass it over to Cello, and then Cello, you can pass it to Jen and then to JC, and then we'll finish off with Kelly, okay? And then we'll open up for questions.
Great. Thanks so much, Tom. It's great to be here. Really great to see everyone, the fellow panelists, and I'm loving the cookies. So thanks for those too. Just in a quick few minutes, I'm always happy to talk about this topic. Like Tom, there's been big changes over my career so far, and I think my read of the tea leaves is it's going to continue. I think days where the public was content for academics to sit here and decide what we wanted to do, I think those days are gone. So it's very good timing for this particular topic, because as you know, the university has signed the Declaration on Research Assessment in January of 2021, and that's a huge opportunity for us. I'd just like to take this opportunity just to call out Dr. Stephanie Warner. Stephanie, just raise your hand. Stephanie is the manager of the research engagement team on main campus in the office of the Vice President of Research, and she is the one that is spearheading the university's efforts to implement DORA. And one of the things, I'm going to just briefly talk about DORA, but I will mention that if you want to know more about it, we have a new short webpage, ucalgary.ca/DORA, D-O-R-A, and that tells you, I think, all that you need to know in a nutshell about what DORA is about. In essence, DORA moves the academy academics away from the idea that we just need to publish in a high impact journal. De-emphasize journal impact factor, de-emphasize other bibliometrics, although not eliminate them, and focus on other non-traditional outputs. So like Tom was saying, not just that paper, but maybe algorithms, computer code that other researchers can use. You know, these sorts of things facilitate other people's work, and also impact. What is it that your work has contributed to society? How does it help? What changes did it exert? And DORA suggests a number of different outputs, and we'll hear about some of them today. So changes in policy, changes in clinical practice, as is done in this institute in particular. Other types of output, such as expert testimony, testifying before Congress or reporting to Congress or to Parliament, to government. Public service that impacts the way that society works, a change in your field, a change in the way that people think about or conceive an issue. So these are all in scope for DORA, and they move the field, I think, like Tom was saying, where we want to go, making a difference. So this is a good time. I think, take a look at DORA. There are other resources for those of you that are in the CSM. The CSM's document, the Research and Scholarship Framework, outlines some of these principles and how the people that will be assessing us when we go forward for promotion, tenure, and merit will think about those things. Now, this is an evolution, and Stephanie's team is helping the academy to think through these things, but we can expect that we'll have more opportunities. So that's how I see it. It's an opportunity. It's not a, for me, it's only exciting. It means that yes, we can continue to publish things, but more and more, it's going to be how those outputs are used, whether they're a publication or something else, that's going to contribute to how we judge. And again, I just think that's really, really exciting. There will be a statement by the Vice President of Research Office that will come out probably later in this year that will give some further guidance on that, and that will complement what the faculties are doing, like the CSM. So we have some great panelists here that will tell you about their expertise. I just wanted to say that, like, from my own, as a researcher myself, I've had the chance to participate in practice guidelines at the national level and at the international level. And each of those has had unique experiences. I'll just give one example. When you work with an international audience, we've all heard about strong guidelines and weak guidelines. It turns out that weak does not translate very well into all languages. People are like, huh, what do you mean weak? Like it's weak, like you can't make up your mind, or you're weak, or, so that this is just one example of how, if you want to achieve impact with that guideline, you need to understand your audience, what they will take away from it, and perhaps use a different term. And it turns out that conditional better captures the flavor of what we mean by a weak recommendation than that's the word weak in other languages, maybe in English too. So that's just one example. I'll just give one other example in the interest of time. It has to do with advocacy work. So I'm a member of a society called the International Society of Nephrology. And we, in that society, a big part of the work is developing capacity for kidney treatments in low and middle income countries. So in my work as a health services researcher in Canada, we may have ideas about what the optimal treatment may be. Some of those treatments may apply in lower income settings and some may not be available. So how do we adapt those treatments? How do we advocate for those treatments at the government level or at the continental level? And how do we work with organizations like the WHO to make guidelines, policy, advice for member states that will help them make choices? And in my field, we provide dialysis to people with kidney failure. In Canada, where we are wealthy, we can afford dialysis for everyone. That makes total sense. It may not make as much sense in a lower income country that for each person they put on dialysis, they'll have to forego treatment of 1,000 other people with prevention with cheap drugs. And so that's been one of the most rewarding things I've enjoyed doing, has been meeting with representatives from member states and advising them on this and saying, no, actually a dialysis program, it's not a marker of prestige. For you, it's wasting money. The time for dialysis for your country will come, but perhaps there would be other choices that you might make today. And I really enjoyed that work. So happy to take any questions at a later time. I will pass to Dr. Zwicker.
Thanks so much. Well, hi, everybody. Thanks for being here. So nice to see everybody in person too. There's a lot of faces I haven't seen for years, so it's exciting. Thanks for the invite and the opportunity to speak about this. I agree. I think it's a really growing area. I think about impact and signing on to DORA, I think, is a big step, and it's an exciting step for the research community. So when I was thinking about translating research into sort of impact in the policy space, I'll speak to kind of three aspects that I think are important. First is the who. So who are you trying to influence? Who are you trying to impact? The second is the what, and the third is the when. And I think all three of those pieces are extremely important. Hard to always kind of have a sense of, so you have to be fairly dynamic, nimble. The first piece around who really speaks to a lot of that integrated knowledge translations type stuff that we write in our grants and think a lot about, but then have to kind of actually try and enact when we're running the research study. And so I would say that from a policy perspective, some of the most impactful work I've had the experience being part of has been on work that's been partnered from the beginning. So often we've designed the studies in a way that had influence from families, youth, communities. So they were kind of part of the development of the idea. And you know, when you think about it, it's fairly intuitive because you're developing a project that has outputs that are directly relevant to the people wanting to find the outputs from that study. So be that community groups, like in the disability community, different disability community groups, or larger national organizations, or working with decision makers from the start can be very helpful. So it's kind of taking a lot of what you wrote in your grant and actually when the funding starts, kind of really starting to actually work with that group through advisory committees and kind of ongoing discussions. That's really helpful. It's also important to engage them throughout the study. So not just at the beginning and kind of come back at the end. Because often what happens is, you know, things get really busy, research timelines are hard to manage sometimes. And, you know, then we come back 2 years later and say, hi, remember me? Here's what we found. Isn't this exciting, right? Like at that point, sometimes it's hard for the knowledge users to really know what to do with that information. They're very politely like, oh, great work. That's nice. You know, keep it up and off we go, right? So I think just thinking about that as kind of from a knowledge user perspective, how important that is. And it, you know, there's a lot of work, Kids for Health Network do a lot around family engagement and research. There's been a lot of work with PACER and other groups that have created groups that are really able to engage in a way with research that can be very much around the co-design kind of concept. So I think that's something that can be really impactful. In doing that, it starts to create a lot of opportunities for impact and knowledge translation in ways that you would not expect. Because, you know, I think as researchers, it's hard to have that Rolodex of community partners that are explicitly relevant to every study you might be working on. But the people who live and work in those spaces every day, they're very connected to the community. So this is a tremendously important aspect. And I think is something that if you can nurture and foster that, again, it's partnerships and it takes time to kind of develop it. You can't just go knock on people's door and say, please disseminate my study, right? Which gets to the piece around the what. So, you know, as you're working on the research study and developing outputs from, you know, maybe you've written your peer review publication, and, you know, I would say writing the peer review publication is so important. It's great to get it out there, published in the journals, that's great, but it doesn't have to stop there. So often what we'll do sometimes for studies is we'll publish in a peer review journal article and then do shorter kind of tailored outputs that are relevant, that kind of disseminate what the article says. So if you're expecting a decision maker in the policy context to read your peer review journal article or find your peer review journal article, that's pretty naive. That's not going to happen. So, you know, it's trying to think about the outputs that are relevant to your audience. And, you know, different knowledge users would be more relevant to different outputs. So a policy brief, for example is a great idea for decision makers. You know, thinking about provincial, federal, municipal government. This is the currency of government that they're tending to use, and often, you know, if you're going to a meeting, if you provide a briefing note in advance, that's what they'll tend to use to brief whoever you're talking to in the ministry, rather than one of the people working in the ministry generating that for them. So you get to kind of shape the narrative. That being said, other outputs for community might be better suited. So thinking of a communique, or, you know, an op-ed, or kind of infographics can sometimes be a lot more impactful for community groups. So it's just thinking about not one output for all groups is probably the best way to go about it. And you could just talk to the knowledge users. So if you're working with community partners, just asking like, what would be helpful to you, right? And sometimes it's not that complicated to generate it from your key messages from the study. So, you know, these are things that have been tremendously influential. The one thing I would say in regards to the outputs is you have to be able to make some recommendations. So sometimes as a researcher, that's a little bit uncomfortable, because we write research papers that have findings with caveats, and, you know, we need to do more research, and kind of that's the nature of way research is. However, you know, you're kind of the expert in this space because you're writing the communication around that. So we don't just want to identify problems. We want to kind of try to move the file forward and see like, okay, well, what should be done to some extent, give some suggestions, give some direction. Because sometimes what you see is a research study just highlighting more problems and then expecting decision makers to solve them. And, you know, that's a tough space to be in to get traction. So just kind of keeping in mind that sometimes you have to step beyond sort of the research study and see in the current context, what might you be recommending in the output. The last piece is the when, and this is probably the most complicated aspect, because unfortunately, all of the impactful opportunities from your study may not happen just when your research paper comes out, because that's, you know, first of all, hard to control when a journal is publishing the paper, right? Knowing when that's happening. And it's not always exciting to the community to say, well, look at my study was published. You know, it's newsflash. Sometimes we do a press release around our paper was published. And to the rest of the world, we're kind of like, well, okay, that's great. There's lots of papers published, right? So, but if you can find sort of, it's both the push where, yeah, you're trying to disseminate the information, that's great. But also thinking about some of the pulls. So just looking at some of the opportunities that government puts out, that you can insert a lot of the findings and evidence that you've generated into a lot of their cycles of information. So good examples are budget submissions. Those are open to the public. We do them regularly. Parliamentary committees, there's numerous standing committees. If you follow the files that exist in the federal government, you can do submissions to the Senate, submissions to parliamentary committees, and they're very impactful, actually. You can also do a lot of work, again, thinking back to the who piece with community groups. So I'll finish with just an example where we worked a lot with national organizations. We worked with like Autism Alliance and groups like that, and often they're getting meetings with decision makers. And if you can work with community partners to be sharing information so they can take it forward to those meetings, that can be tremendously influential, because they're speaking from their own experience, but they're using evidence to back up their own experience. And I've sat in meetings where we were talking about a disability tax credit, and we had a parent who was briefed on the research from Stats Canada around this study that we'd done. And the parent looked at the policy advisor and said, you know, the disability tax credit is a horizontal equity instrument, and, you know, was really giving them information around the whole premise of the tool. And I thought, wow, this is really powerful, because they were telling their story, but then they were putting, you know, information forward to say, like, this is not just my experience, this is the experience of a large group of people, and it's backed by evidence. And so, you know, I think that can be a really powerful way to, you know, it wasn't Jennifer's Zwicker study, this is amazing, right? It was like, let's try to get this information forward into government, and however it needs to happen, right? So I think it's for the researchers to step away and say, it doesn't always have to be you doing the knowledge translation to have impact. So Yeah, and I would just say, also remember, just your newest study isn't always your most impactful study, right? It's okay to go back a year or two. You know, maybe all of a sudden that's very timely and kind of bringing some of that information forward. So just kind of thinking about some of that. So with that, I'll hand it off to Jason.
Awesome. All right. So when I was approached to do this, I kind of like wanted to focus really about impact as like a function of working maybe at the lower level that Jen was talking about, and more working with public servants and administration. So basically my work is on data analytics and social media interaction. So my team, we have 11 people. We're actually a real transparent team. We have software engineers, data scientists, political scientists, economists together, and we build projects using machine learning and building machine learning code to measure misinformation, all sorts of things on social media. And most of these codes are actually used by the Department of National Defense, Global Affairs, NATO, the WHO, AHS, and we kind of use off-the-shelf open code things, and we help them kind of design this. So my team is running a bunch of projects, and we partner with different kinds of people. We partner with National Defense. We have a big grant from National Defense to help them design their strategic communication operations. The information space is getting, weaponized. Russia, China, and National Defense doesn't know what to do with it, and we're helping them do that. We work with Global Affairs Canada. They have a team measuring and tracking foreign interference. You've heard about the Chinese, but we've been doing this with the Russian people. They're asking for help, and we're helping them design these things. Their team is relatively small. The Global Affairs team to track Indo-Pac misinformation is 3 people, and they cover India, China, Iran. That's it. That's foreign interference in global affairs in Indo-Pac is 3 people. My team is bigger than that. I work with AHS, and we've been working with AHS since 2019, building social media tools to measure anti-vaccine conversations online. We were doing this before COVID with HPV, and when COVID hit, they were already having a team doing HPV, and then they said, like, can you want to do COVID too? We did COVID too, and now we're back at HPV. We worked with the WHO to help them design their digital platforms, communications for HPV vaccination in Africa. We work with NATO to work on Russian disinformation and tracking and building codes for them. And we work with big pharma. So we have relationships with Merck and GSK, and we help their communication teams understand better how to design communication practices on social media, how to measure vaccination, anti-vaccine sentiment, how to design communication strategies that work better. The ones that you're seeing on Gardasil HPV, I saw this a year ago. And we were having these conversations at the design phase of like, what do you think about this? And should we do this and that? And I disagree with a lot of what they've done, and I agree with a lot of what they've done. So like, I'm happy because there's still work to do and still impact to have, I guess. So if you think about my work, is basically working with government folks at the GOA National Defense Team at the international level in international organization and with businesses. So that's kind of the intro. And I was thinking of this thing of thinking about impact and then the challenges of impact. So I had the challenges before and the impact after. I think we're just going to do the other way around, I guess. So the real impact is really have a relationship at the operational level, at the policy delivery part. You can have a really stratospheric impact on the public debates, and you can have a good impact on policymakers and Senate committees, and I do that work too, and speak to MPs, and this is great. But this is really at the lower level where we engage with public servants or people who are first at the forefront of designing these programs and putting them in place, but also responsible for actually, delivering these policies in the real world. I'm a Star Trek fan, and there's like a super good, if you Google it on YouTube, there's a Make It So Picard team, right? So every time like it's Star Trek Next Generation, like, Jean-Luc Picard was the captain of the ship, would sit down and then like somebody were like, oh my God, Captain, there's a black hole heating up our half shield. And it was like, we need to do this thing. And then Picard would say, make it so. And the thing is like, the captain actually doesn't do anything. He just says, make it so. And then like all the minions are actually doing stuff, right? So like the impact is really at that level of being people having to make it so. And that's a very rewarding element. It's undervalued, it's not glamorous, but you're really in the trenches with people actually trying to connect policies with deliveries at each and every level in national defense, global affairs, international stuff, or public health. So you really have like an impact at the operational level, and that's a fun thing. The issue is that how do you measure this? And every time I see Dora, it's like, I'd like to put like every stupid meeting I have with AHS, which is twice a week, and national defense, which is twice every 2 weeks, and all of those little meetings as like impact, but like I don't know. I don't do it. I'm just too busy to kind of like do an Excel spreadsheet for this. So if you think about the impact, I would put it into kind of two ways. On the one hand, it's impact at the input level. You have, as an expert in that field, that allows you to inform conversations on policy delivery. You're able to connect directly to the people actually, trying to think about how, like, okay, the minister said X and Y. How do I do this now? They gave me $1 million. What do I do? And then you're able at the forefront to kind of link research and all your knowledge you've done in that field with like, okay, now we have to do this for this thing. And that's a really interesting element of policy delivery. For example, my team is responsible and involved in a lot of the communication plans that you're seeing right now at AHS, at Merck, at other pharma on HPV vaccination, either in Alberta or in Canada. So I can see myself left and right, like I know I said this, and that's why there's an LGBTQ couple now in that thing. And we've been around this and saying like, stop emphasizing women, health benefit and focus on men health benefit. Like we know now where we are, but nobody will tell us. So you just get a bragging rights to yourself. In terms of output, it also allows you to build, and this is what Jen was talking about, like really projects that are co-constituted with the people actually doing this. So at the forefront, once you have these relationships going, you get the information from them saying like, my priority, my concern is I want to build an HPV vaccine for 18 to 26 in Alberta. What now? Right. And then at that level, you can say like, okay, I understand in terms of output and how to build a project that does this and how to, inform how the communication plan will be designed, but also on the back end, how to build, evaluation practices or evaluation of those practices. So right now, you probably haven't seen it, but AHS built an HPV for 18 to 26 campaign on social media. You probably saw this on your Instagram if you're Calgary. That was our team, and now we're actually collecting the data to actually see if it works and in what respect, and did that drive people to actually get vaccinated, which is, maybe a lot of people see the tweet, but do they actually go to real, vaccination uptake? And that's the hard part. You can have like a lot of data on that, but it's hard to really do this. Thirdly, in terms of impact, you get involved in informal conversations. One of the things that I do and my team does is we have these meetings informally with all these partners all the time. Even when we don't have a project, we talk to them. What do you want? What do you think? What is your priority? How does that make sense? How can I help you design this, right? What do I know now? And as you build these trust relationships with people within government, then they actually come to you. So like, we have this to design. And it's probably the same thing with Jen, but now we get paying a lot for projects and money to say like, we would like to do X. Do you have the time, the capacity? Here's $100,000. And then we're like, yeah, we can do this or not. Usually it's a capacity problem. But these informal conversations allows you to kind of preempt priorities. Where does the government is going? Where is it going? How can I link my research to where the government is going? And those priorities are easy. If you want to have impact, you have to be, there's a question of timing. You have to be at the right time, at the right moment. And when the government needs it, then you're on board. If they see the study 2 years afterwards, like, yeah, well, thank you very much for those wonderful insights. We wish we knew this 3 years ago. So being in the conversations, you kind of start to intuit the priorities and you know where things are going. A good example of this, we did a study on Russian disinformation, which got us a lot of heat from the Russian embassy, from the far right, from the far left, and we're really happy about that. And it was the first one published in Canada. And the reason why we were able to do this, because in November 2021, in informal conversations within the government of Canada, they were saying like, we think the Russians are going to invade, and we think they're mobilizing around Ukraine. We think they're going to invade. And that question at that time is like, how will Russia design information operations to kind of create an information space a little difficult? So my team said like, hey, we can scrape this. We opened an API in November 2021, start to collect tweets on Russian disinformation. So when the invasion happened in February 22, we're already on the ground, already kind of listening and building millions of tweets a week. And we were able in a month kind of produce data that actually kind of identifies main influencers in Canada promoting pro-Russian narratives. And we're really happy now because a lot of them who complained at that time of censorship are now going to Russia, or they go to RT.com and kind of explain how Canada is not great. So we were able at the forefront to kind of know where the target was, what we do, how to design a project for this. And when that happened, we were actually on the ground doing something, have an immediate impact, and be one of the first teams to actually do this. And in terms of impact, also, it becomes a hiring pipeline. Now at AHS, I have a couple of my students who did work with me. At National Defense, I see them. At Global Affairs, I see them. And they're starting to poach my team all the time and my data analysts, which is a great, it's hard for my team because we have to always kind of keep up, but it's really rewarding when you see like people in government now like trained by you, they're now in the trenches, they're really doing work. And you say like, maybe my impact is to build a new generation of scholars and giving down and promoting this and having them grow into government is maybe the most lasting impact I'll ever have, except with my paper with 300 citations. Nobody cares in a this comes with challenges, and I have like 25, but the first part is lack of resources. In government, there's a lot of goodwill. There's not a lot of resources to do anything. So as a team, we're often take the position as a support function. We help them do stuff. National Defense right now, for example, we're building their capacity to automate media monitoring. There's still somebody waking up at 4 o'clock in National Defense, reading all the newspapers and doing a memo, a resume, or like a brief for the minister. It's crazy. I can automate this in 5 seconds. It's going to take them like 6 minutes of doing anything, right? So we're building the machine learning for this and kind of the ML pipeline to do this so that National Defense can do this. Then they just scrape the data, analyze it, give trends, do the visualization, and can go with ministers. So, hey, minister, we've done this. But we are the support function. They don't have necessarily data analysts or the expertise to actually do this. They know they want this, but they just can't get either the people hired, they can't pay them, or they just don't have the expertise to do it. So we built that for them. And we're doing this for AHS too. The second challenge that, and Jen talked about this, you have to engage in kind of output-oriented conversations. Really what they want is really kind of focus on basic questions and that can inform their decisions. And you have to steer your research projects toward that, like all the time. Like they don't, like fundamental research is great, but that's not where you're going to have an impact at the government level. You really want to focus on the output level. It's interesting, but it shifts the way you kind of address research projects. Like you don't really necessarily focus on like these, I have like 5 theories of why this is, and we're going to do this super interesting survey experiment to kind of measure this. They don't care. They want like specific things. A good example of this, we did a survey experiment on the impact of discrimination in the Canadian Armed Forces. So the Canadian Armed Forces are having issues with sexual misconduct, but also discrimination of equity-seeking groups. And National Defense says, like, we don't know what's the impact on people, like on the trust in the military. Do Canadians care? And it's an empirical question, right? It's not really theoretical, it's empirical. And so like, we can design this. So we built like a survey experiment, look at, different kinds of equity seeking groups, women, LGBTQ, Indigenous, First Nations, Métis and Innu, women, racialized Canadians, Francophones. And then we did a survey experiment to do this and with a control group and kind of go to national defense, like this is what the impact is. And they're like, thank you very much. Here's the brief to the minister. Minister, this is why we're doing X. And we see these emails like the minister here. So really output, focus on what they're doing. Thirdly, it's time consuming. You don't know how much time I spend on meetings every week. And I mean, senior admins like always do that, right? But as an associate professor, it's really challenging, right? How to maintain your research profile in an environment where you have bi-weekly meetings with 5, 6, 7 partners, and that becomes, you know, a Zoom to death experience. And I don't know how to do this better, but it takes time, a lot of time, beyond just writing the paper. And thirdly, you know, the exploration phase is super long. It takes time to actually create any output. You have to be patient. It's a bonsai. You have to water it a little bit and keep it growing slowly but surely. But you have to be, you know, really, 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 really patient. I have a monstera at home, which is a jungle plant. I just water it and like it becomes super big, super fast. It's super rewarding. A bonsai is like it's not rewarding at all, right? So the exploration phase is super important. Like how to understand their capacity. What can they do? What can't they do? And sometimes they can say they do things and they can't do it. And then you have to understand that. Understand their needs. Like what they didn't want to talk about. What really is the focus of their ADMs, their DGs? What is really their challenges? One of the things we found out, for example, is that we could do the super well, good, accurate, you know, machine learning model. But when they brought this to the ADM, the assistant deputy minister said, like, I don't understand this. So now we spend a lot of time on data visualization, and then we train their teams on data visualization. Let's focus on that. How do you translate data into pictures that a data illiterate person could actually see? So like, okay, I understand now where we're doing X instead of Y. Say no if demands or hopes are unrealistic. They have like a lot of hopes of what you can do, and sometimes you can't. And finally, like, know your place. Academics, like the job of an academic is not to become a public servant. So the place of us is really like, we have more time than they do to do a lot of the deep work that they don't have time to do. So we take and shoulder that work. We're going to do these. We can spend 4 or 5 weeks on something and do something really long lasting. And also like understand that they have domain expertise also that you can draw from. And so be humble in that conversation, right? You're always kind of in an iterative process of understanding where they come from, learn from them, see how you can translate your research to them. And how to do this. And finally, how to balance your academic life with that kind of work. And I actually don't know. Like in my CV, if you look at my CV, none of this work is actually aligned anywhere. So merit increments, conversations on that, none of this gets accounted or at least valued as the way I think it is. So it's really kind of work of love. Where, you know, your impact, like, you know where you are and you see it when you know it when you see it, but maybe not a lot of people hope. If you're hoping for impact, if you're hoping to engage in this work for impact instead of actually doing the work, then maybe this is not for you. Focus on the work, focus on the love of actually engaging in really policy-oriented questions. And I don't know about the impact. I try not to think about this all the time, because I think you'll find this probably not as, you know, rewarding. Your university, your chairs, your deans probably won't understand how much time and dedication this takes. And maybe that doesn't matter at all.
Okay. So just everything that everybody said plays into me like 100%. The biggest thing is audience, for sure. Who's your audience? Who are you trying to reach? But the one thing about trying to decide on studies is the most important thing is boiling it down to one thing. And I'm looking at Fiona because I actually asked for her permission to talk about this. Fiona did a policy paper, 200 a synthesis of, they were trying to help set policy for Alberta when cannabis was about to be legalized. And what do we need to know and how does that work? 289 pages 5 areas of expertise. It's like, this is not, no reporter in the world is reading that, not in a million years. And so I go into yourselves because we're trying to decide, well, could this be a media thing? You know, like we're going through the document and, you know, we looked at each of the topics and one was harms. And so I said, so what did you learn? Like, what was that about? And she goes through a couple of things and then she says, oh, and people are testing positive for THC even when they haven't inhaled. And I'm like, what? So we start talking, and what was true is you could be exposed to THC on secondhand smoke and potentially fail a drug test. Now that's what people care about. That is the single topic from that 289-page document, because that impact is going to be at that policy level, at those things. It's going to be directed at the groups that you need it to. You're going to pull it out for certain areas of government, but for media, for the public, that's what matters to them. They don't want to go to Northern Alberta on their flight and fail their drug test when they get there, when they, you know, decided to do the right thing and be the designated driver and not participate. So boiling things down to one thing I find is really hard for scientists. Part of the difficulty I find is, you know, some of the folks that don't get out of their labs that often have been in there for 20 years with this incredible finding, and they're so excited, and but they can't take 20 years to tell it. They got 20 seconds to tell it. So finding that one piece that really works for me is important. Media is also a relationship. So as much as we want them to come and talk about us, they need us. And this is also a challenge that scientists have. I want to congratulate Jennifer, because she steps out a lot on a lot of different topics. And it's critically important that it's a quid pro quo. So, you know, lots of times I'll hear from scientists, I don't want to do the apple pie stuff, you know, like they don't want to talk about the simple stuff, but it's the simple stuff that people care about, and they care about it in the moment. So they're always going back to the well for the same information. It's like one time one of the scientists said to me, well, Kelly, can't you just take my conversation and send it to all of them? No. You have to talk to all of them, and you have to say exactly the same thing to all of them. And that can get really annoying. And Fiona, I don't know, that one day, I think you did like 20 interviews in that one day. It was a lot. So, and during COVID, I know that lots of familiar faces here, Tyler Williamson and Craig Jenny and lots of others. Like, I think the first year before COVID, I think Craig and I had done, I want to say 6 to 12 interviews together in a year. First year of COVID, he did 500, second year, 1,000. So that's a lot of time, and it takes time, and it's super annoying sometimes, but you have to think about that relationship and how is that relationship going to be? How's that going to work? The thing I'd like to say about like outside of media is you can also be like a subject matter expert. So it's not just about your studies, and that's part of that availability. It's also about what is your area of expertise? What could you speak to, and how can you help? And finding the timing is critically important. Like right now, the O'Brien Institute, we're trying to go up the policy papers. I know yours came out recently as well. I was working with Dana in your area, but it's looking at what's the timing and where does my work fit into this picture? Is there a reason for us to go to media and offer ourselves as an expert, or to stand as an expert? So people who don't like apple pie stuff and aren't going to do it, that's fine. But like Eddie Lang, good with the apple pie stuff. You're going to hear Eddie all the time. He feels that's important, and he feels that's part of his role. And so it's thinking about those things, like where can you fit in as that expert, if that's what you want to do. But for the public, that's where the impact comes in, for sure, if you're not in a special group or in a special area. And it's also getting the name of the university out. Like, this is why we're here. We're here to solve problems. We're here to answer questions. We're here to educate. And our leadership at CSM has been excellent, because one of the things they feel is very important is that education piece. So in that space of misinformation, where can we be? How can we show up? You know, how can we help facilitate? The other thing I'd like to say to you is, when you're looking at outputs for your studies or things, or, you know, what audience could we look at? One of the biggest vehicles we have right now is called Conversation Canada. I don't know how many of you are familiar with it. I see lots of nods. But if you're looking at, should I write that op-ed or is there a way for me to get into Conversation Canada? Go for Conversation Canada. You work directly with an editor, so it's all your words. It's not inputted by a reporter who's deciphering what you said. It's you get the chance to, you have to take a subject and you have to make it very accessible to the audience. So one of our researchers who since 2011 Conversation Canada launched, there have been 10 million reads of articles written by University of Calgary academics alone, all over the world. So that's worth it. Sherry Madigan just passed 1 million reads on her articles. She produces a lot on Conversation Canada, but some of the topics are like 14 signs your daughter has ADHD. Okay, well, that might be something, you say, that's pretty apple pie and I don't want to do it. I'm telling you right now, every single person who has a kid whose daughter misbehaves or acts out is going on Google and going like, oh my God, does my kid have ADHD? And so that one's getting read every month and it's one of our best ones. On policy stuff, it's looking at what else can we talk about? So one of the titles was, this was not a Calgary academic, but food prices are not the only obstacle to achieving food security. Root causes include systemic barriers. So that's your that's your angle. What's happening and how can I get in with my expertise and say things that are important? For health, 3 ways to unlock the power of food promoting heart health. How-tos that people can do. These are the kinds of simplistic things that, you know, sometimes seem maybe too low level, but it can have a lot of impact. You know, that's all right.
Great. Yeah, well, thank you, panel. And so why don't we open it up? Marika, any questions online? Yeah. From the audience, I've got questions here to get us going.
Can I add a comment while people are,
Yeah.
just to very quickly, and those were, I think, really great points. I think sometimes in the policy space, we put policy and media as like synonymous sometimes. And I think it's for researchers to recognize that like, there's different ways to connect with government. You can through media and like call it kind of the megaphone versus the policy whisperer kind of side of things. But just recognizing that like if you're trying to change policy, if your first action is to kind of go to the media and say, this needs to change, this is important. Sometimes that's a hard position to come to have like ongoing partnership and relationship with government on those same files. So it's thinking about how you engage in those different spaces for what purpose. If it's public awareness and speaking to media, or sometimes maybe it is to get the government attention on a file with media, but it's just recognizing that they're not always like one and the same, right? And I think that's important because I see sometimes people thinking that like, oh, I'm influencing policy because I put out an op-ed and trying to get awareness around it. And it's like, there's relationship capital that you have to balance, I think, on some of that.
Yeah, excellent.
I really appreciate this conversation and a lot of what you're saying really resonates with me. And I'm like thinking a lot about what you said about the time, because all of my research is community-based research. And most of the time comes after the research is done. And so, but you do it because you love it, right? You do it because there's impact in it. But we still live in this reality of where we are judged by certain standards in the institution. And I understand that that's changing. But I actually created a section in my CV called Community Impact, which doesn't follow the template that we're supposed to use for our CVs, right? And it's hard to translate that to merit and promotion, to when Fiona is my department head, so she knows me and gets it, but how do we actually message that in a way that this is true impact?
Do you write it as a narrative, like a
Yeah, I do.
story?
Yeah, and it's not short, right? Like
Yeah,
you can't write that in a short like journal citation.
Yeah.
And so I wonder about the sacrifice I make is that my publication record is abysmal. Like it's embarrassing in this school how many publications I don't have, but I do all these other things that fill my soul and have an impact that I love to talk about. So I don't know, do you have any thoughts? And I know, Cello, you're involved in the senior level in terms of how we recognize this in our scholars.
So it's a really good question. I try to tie, like when we build projects like this, I always try to build a paper into the project so that it actually forces me like to give a publication, right? So to kind of like have this kind of output, like, you know, paper number one is, I don't know, a good example, we want to work on LGBTQ and HPV vaccination in Calgary. A lot of community engagement, like none of this can be done without community engagement, but it's also like, you know, vaccine uptake. It is also all sorts of interesting things, right? So we're saying like, okay, we're going to build a project looking at, you know, communication and LGBT community, like equity seeking underserved communities and how to engage with them and do a paper on that, right? And how to do this. We're going to design a study, we're going to do survey experiment. So that's going to be what paper number 1 and 2, but also all the other kind of community engagement, talk to Merck, talk to AHS, get them vaccinated, and then increase the vaccine uptake of the LGBT community in Calgary. That's going to be the Sunday, right? Or like that will be the Sunday. The cherry is the paper. The Sunday is actually the community work, right? So I try to do this all the time because you're right. There's a lot of work that is not accounted for and doesn't produce like a paper. So I try to be very diligent in doing that. Like, what's the paper? What's the paper? What's the paper? Okay, that's paper number 1. Perfect. We with AHS we work on gender-based communication and how it did a lot of harm to HPV vaccination, right? Like we see this in the anti-vaccine space. Oh, well, I don't have a cervix. I don't need HPV vaccination. And all of this is done for 20 years of targeting women for HPV vaccination. We're undoing this with Merck, and now their communications are not about that. But we have a paper on that. So we collected millions of tweets, kind of argue how the anti-vaccine space are using gender-based conversations to promote women as a victim of big pharma, those kinds of things. So there's a paper, but all of this is kind of like Merck, this is why you have to do this. AHS, that's why your comms plan now has to include these things. So we do both. That's the only way I can find to kind of keep, I have a good publication record, it's actually getting better. And that's the only way we can do it.
So we
Really.
just have to do both. That's basically what he said, right? We still just have to publish.
Yeah, I mean, I think you do, and I think sometimes we can get caught up in like the time that it takes in the community partnership, but stepping back as academic and recognizing like, just because we've engaged in this way with one partner, there's probably value in not the details, but kind of the process, so that you can do that, so you can share your learning so people can kind of learn from that and do it differently in the future. So that's in the space of implementation science, in the space of integrated knowledge translation, co-design. And so, you know, I think that's what we bring as academics is trying to bring some sort of process structure and kind of new innovation or methods to some of that engagement. So yeah, probably don't go into the explicit detail of that partnership, but like, you know, sometimes it's a protocol you can publish, or sometimes
It
it's
becomes a paper.
yeah, it's there's pieces that it helps you, I think, step back and recognize what your role is in that partnership. And I think often it's not to be the advocate in that partnership, it's to support those community groups so they can go and do that work. And in doing that, you can sometimes take a lot of information and share it with other groups in a way that might be impacting more than just that one community group. So I think that's the way to help frame it so that it actually doesn't end up being that much more work, really, because you've sort of written the terms of how that's going to roll out. Maybe it's
Still more work. It's still more work, but she's right. Your support.
Yeah.
You don't do.
I mean, I think that the papers you shouldn't view papers, in my opinion, as being just a sterile deliverable. I mean, people are probably very interested to hear what you're doing and how they can do the same. I think the other comment to make is that, you know, DORA isn't supposed to replace one kind of academic, I'm going to do my own thing with another, right? Where it's you know, when the example I gave is someone toiling away in the lab and something of interest to them, that's out. Okay, fine. But equally, I think, you know, just meeting with people, and I know this is what you were suggesting, but just meeting with people in chit chat also wouldn't be a good thing. These things are both means to an end. And, you know, even the examples that JC is giving, like, who cares how many people get vaccinated? You know, that's not really what we care about. Why do we vaccinating people with a useless vaccine, right? Would be a waste of money and time. What we want ultimately is to improve health. And we believe vaccines are a measure to that. So these are all incremental steps to what we really want, which is societal impact. So it doesn't really answer your question, but I think you got some great suggestions about thinking about a blend of deliverables and also thinking about how to make those deliverables, even if they are a paper, useful. I think, I think your papers would be great to read. Inspire others, right? I could do that too.
Mindful of time, hours going by, maybe you have time for one more question.
I'm sorry about my English. I am Brazilian. I'm going to try to make a question because I have studied sometimes the use of the research result. And there is a lot of uses. The article research is one of the uses. The policy making is one kind of using the research results. But we work with health evaluation. And sometimes we face some difficult situations with the policymakers because sometimes they get a part of the result and wants to give a light in this part only, but it's kind of distorting the result as all. As, for example, a program or a service that were evaluated and they highlight only one good result for, as they are politicians, they want to re-elect. So it's difficult for the researchers when it happens. And I wanted to.
Media does that too.
Yeah, it's a difficult situation. And another situation in this case is when the results, for example, we made an evaluation of a service in a city, and they use it to tell to the population that the service was the best of the state, and the evaluation didn't show this result. So they got our studies. This is not a good study. The methodology is not good, and so they refuse the results because of what it can.
I work on
So-
Russian and Chinese disinformation.
something-
I get attacked and all the time, and you're right. You like, as soon as you play in that policy space, political actors will use or misuse what you do. How do you engage ethically in that space is like, I try to be honest with myself. Is this the best that I can do? Is this what I think is the best that we did? Like, be honest about like, yeah, I think we did, like, we collected the data properly. We think we analyzed it properly. We think we explained, like, I'm okay with this. Does that mean that that's the end of everything? No, like, as well as I do that, I would redo all the papers I've written so far, right? And better. And you learn in that process too, right? You have to be, sometimes you put out something, so like, that's not what exactly that said, but I can see how somebody would speak to that. And maybe that speaks to what she was saying, like, especially on policies, one issue, focus on one thing. If when academics say, well, it's complicated, like you're losing the media already, right? Because they're like, I don't want this complicated. I have to explain this to like normal people. So what do you do, right? So like when we write policy briefs and at the School of Public Policy, we spend a lot of time like boiling down, like one thing, focus on an issue, focus on that one story. And at the end, you can't really control what people will do with your study. And I try to kind of accept that too, right? Like if it misconstrues, I'll say like, that's not what the paper says, read it. And I use it as an opportunity. Like I get a lot of pushback from far right and tankies. And I say like, he says this, that's actually not what the paper says. Here's a click, read the paper and tell me about it. I use it as an opportunity to inform people, right? And like have them read the paper. So, but you don't really control that. And you have to let go at one point, right? Like be honest as an academic and as a person, do the best work you can do and walk away and learn from this and say like, well, yeah, we could have done it better. Yeah, they're right. This like the way we characterize this tweet or that category might not have been the best way. We're going to do it differently next time and learn. Like that's the best thing that we have, right? We can redo it.
Okay, so I think we're going to have to bring the session to a close. Lots to talk about. I want to thank our panelists, such as Tonelli, Zwicker, Boucher, and Johnston. I want to thank all of you for coming out. I want to thank Mariko for making today possible. I want to thank Fiona, the Department of Meal Sciences, for bringing us lunch. So please enjoy. if you've got questions, maybe you can come up and grab the panelists before they disappear. They've got lots of experience they can share with you. And I want to thank all of you for everything you do to advance public health. So thank you very much and have a good rest of your week.
I'm sorry, we took like too long and it was too big a